Padma Shri Dr. G.N. Rao ji, Founder Chairman, L.V. Prasad Eye Institute, Dr. Subodh ji, Dean ASCII and our knowledge partner, my colleagues Shri Meela Jaydev and Shri Suresh Singhal ji, Managing Committee members, past presidents, vision architects, guests, press and media and friends. Hearty welcome to this vision document release program. It has been a great journey since last 3 months. The journey has been undertaken by our health chair, chaired by our past president, Shekhar Agarwal ji. Sir, in the last 9 years, the state's healthcare system has made significant strides with substantial increase in the health budget of the state. There is visible improvement in the healthcare with setting up of state-of-the-art diagnostic facilities, teleconsultations, Basti Dawakhanas, new medical colleges in every district, increased MBBS and PG seats, establishment of super specialty hospitals in Hyderabad, Warangal and many more. I commend the vision and efforts of our Honorable Chief Minister in leading the state to become number one in many aspects, including health sector. The state is ranked as third best performing state by Niti Aayog. Effective implementation of schemes like KCR Kit and Amma Audi have improved the maternity care facilities and welfare of mother and child. It is a fact that people are preferring going to government hospital for childbirth, as the government is insisting that delivery should be normal unless it is absolutely necessary to undergo C-section. The support and the guidance which we have received, Padma Bhushan Dr. Nageshwar Reddy ji and Padma Shri Dr. G.N. Rao ji, is unprecedented, and no words match the depth of our gratitude to them, sir. Sir, I am sure if Telangana government hires one of the top 5 research organizations like KPMG, ENY, PwC, etc., you would not get as quality document as Vision 2030. The document reflects the amount of work and dedication that the architects put into it. FTCCI is truly and fortunate to have Shri Shekhar Agarwal, our past president, as chair of the health committee. He led the preparation of vision document, and everyone here will be surprised to know that he worked for more than 12 to 13 hours a day for the last 2 months, and he was meeting doctors, government officials, public health experts, media, NGOs, insurance experts and various stakeholders in preparing this document. I also appreciate Dr. Sanjana for her passion and dedication, one of the team member of our health committee, who along with Shekhar ji worked every day till late night, and one intern, Ms. Deepika, she also contributed in preparing this document. The document contained 15 recommendations, and my sincere request to the government is to implement them for the benefit of our people.
Amidst colleagues and friends. At that outset, I would like to, on behalf of ASCII and FTCCI, I would like to thank FTCCI for giving this opportunity as a knowledge partner for this important document on the Vision 2030 on quality and affordable health for all. I would like to talk a little bit about the vision document, on why it was started, what is that the relevance we have, and then we'll talk a little bit about the recommendations. As Anilji already mentioned, Telangana is already ranked number 3 in the healthcare among the states after Kerala and Tamil Nadu, and this has been achieved ever since 9 years. So first of all, a huge round of applause for the state for doing that. Now there will be a question why we need a vision document when Telangana is already doing really well. But we thought that we need to excel much more. We have made huge improvements. I think I always believe as a health professional that if you can improve your infrastructure and manpower, 50% of your problem is solved. And that's something Telangana has done continuously in the last. Every district now has a medical college. Every, a lot of, I think we have heard news about assistant professors being added to all these medical colleges. We're tackling that, the healthcare professionals issue. we are actually now dealing not just about primary care, secondary care, and the tertiary care. We are also looking at the quaternary care, which means we have a lot of 5-sector care, right from the villages to the super specialty hospitals.
G.N. Rao ji, Dean, Administrative Staff College of India, and our knowledge partner, Dr. Subodh ji, our dynamic President, Anil ji, Senior Vice President, Jaydev ji, Vice President, Suresh ji, Managing Committee members, a big way to serve the healthcare sector in Telangana, India, and the world, and also to address the challenges of unemployment. There is a huge potential for human service, employment and investment and economic growth in health sector. Sir, as China has become a leader in manufacturing, Telangana and India can become the world leader in healthcare. Sir, good practices from institute like LVPEI Eye Institute and small scale Shroff Memorial Hospital may be learned and implemented. Sir, Ayush practices have been offering good services over last many centuries. To be relevant for today's world, they must consider to work on the validation of their medicines and systems and the top priority. Sir, allopathy is one of the most scientific way of treatment and is helping the world in a very big way. All forms of medicines have their own strengths and own limitations. Alternate forms of medicines must also be understood to leverage on strengths of each other systems to provide more patient-centric and affordable care. Sir, for health must be considered as fundamental right of every citizen. I request Government of Telangana to kindly, sir, take a lead on that. And sir, they're very, very important. The time Mother Teresa, she came to India, and one night she was coming back to her home, and it was a bit dark over there, and she hit with something. And she put her torch on there, head of this person on the lap, and the person was asking for water. She dropped a few drops of water in his mouth, and then he took the last breath of his life. So here is a dignity of death and dignity of life. Can we take the human values to the next level where we can have we can dignify life and also death with dignity?
I think you have taken an enormous challenge to deal with, to provide equitable and quality care, health care to everybody. Universal health care has been the dream of every country in the world. And indeed, very few have achieved anything closer to that. I was in the United Kingdom just last week, and a lot of discussions centering around how their once exemplary National Health Service is crumbling today because of various influences around the world. A few months ago in The Economist magazine, there was one sentence that attracted me. It said, "We live in a fragile world, affected by climate problems, pandemics, energy crisis, human stupidity, fighting with each other, and a combination of all these makes everything very difficult and becoming increasingly more difficult as it looks." It is against this background that we have to create a system that takes care of every citizen of the state with high quality and equitable care. When you attend many of the medical meetings, these two words are used very freely: equity, equality. very difficult words to practice. When we look at healthcare broadly, you talk of universal healthcare, you're talking about prevention, promotion, diagnosis and treatment, that is curative, and then rehabilitation. When we apply these four divisions to the healthcare system that we have across our country, in promotion and prevention, we do well only on a mission mode. When we do it on a mission mode, like polio, more recently COVID. But on a consistent, sustainable basis, we don't do too well. That's where attention has to be paid significantly, as has been pointed out. We recently looked at our own data of work in our primary eye centers. And what we have found out was, if you create a good infrastructure, place well-trained human resources there, and enable them with all supportive systems, 75 to 80% of the people who are seen there don't have to go to the next level. And that translates to enormous economic savings for the individual as well as the family, and on a macroeconomic scale for the entire country.
A very good evening to all of you. It is a great privilege to be part of this, hearing to all of you, particularly Padma Shri Dr. G. N. Rao Garu, and also the entire journey, how this whole document has come into being. Mr. Shekhar Agrawal, all the others who have spoken before me, particularly from ASCII, Mr. Subodh, then others like our Mr. Agrawal. So it is a really great initiative. Generally, vision documents are made by governments, but a industry body coming up and taking that to a topic like health is really commendable. Actually, Telangana has done, under the dynamic and visionary leadership of our Honorable Chief Minister Sri K. Chandrasekhar Rao, tremendous work in this sector, particularly to make Telangana Arogya Telangana. Before I get into what are our achievements in sector of health, it is important to highlight a few points on how within the last 9 years plus, how the Telangana has changed on all the sectors. It is very evident that Telangana has gone for a model which is integrated, and it has led to all-round development under the visionary leadership of the Honorable CM. Today, if you see our per capita income, we were earlier in 2014 on 11th rank. Today, among the medium size and bigger size states, we are number one, other than, Sikkim and Goa, which is, very small population, we are there. If you see India, there it is, say, 1.7 lakh per capita income is there. But if you see us, we are at 3.08. So such a huge gap. And this has been possible due to constant effort of all stakeholders coming together. If we see the years of 2020 and 21, I think they are like such years in our lifetime or humankind itself, which would like to erase from our memory. Corona gave a very severe jolt to all sectors. It was such a challenge to handle such a kind of thing which for 1 century nobody has seen. It put to test each and every sector, each and every infrastructure, human resources across the world. Every day was a new challenge. We sometimes had no answer. But what I found was the spirit among people, among doctors, among officers, among every sector, people from all walk of life who were determined that no, we will overcome. Many times we had no solution. Suddenly one thing will come with this drug, if we get, everybody can be cured. And after a few months we'll come to know that that drug has actually no impact at all. If it has any, it is negative only. So that kind of situation we faced. Suddenly we realized that we hardly have beds which are oxygen, where there is an oxygen availability. Dr. G.N. Rao and others also will take into account, and we'll see that we provide good quality healthcare to all. And this is going to really ensure that our people do not get into any kind of issues and those kind of things in future. So I'd like to congratulate the entire team which has worked so hard, and which really means a lot, because doing such kind of exercise is not easy. And I could see the photographs which speaks volumes about what you have done, meeting so many people, getting their views, and the most difficult thing always is to put them into practice. I would like to really congratulate all of you, and I'm sure that this will really put Telangana on a very good wicket. I would like to also thank Mr. Anil Agarwal, the President, then all others who have made it happen, the Vice President, Mr. Saigal. So all of you who have come, my ex-colleagues, I can see Mr. B.P. Acharya, Mr. Ajay Misra and Prasanthi, they are all there. And so definitely they will also help us to take it to next level. So with this, I would like to thank all of you for giving me this opportunity, and also giving me opportunity to listen to this report. Definitely will take it up seriously. Thanks a lot.